vaginal and rectal suppositories. Before we do anything, we're going to check with the MAR, make sure we have the right medication, the right patient, make sure we're actually supposed to be doing suppositories to the right person. So the right patient, the right medication, the right route, the right time. You just want to make sure all of that is correct and the right date. So for the vaginal suppository, we're going to use mechanizole, and for the rectal, we're going to use preparation H. So I'm going to go ahead and perform my hand hygiene, put on my gloves. I'm going to again just double check. I'm going to make sure I check 3 times with the MAR and make sure it's all good to go. So we're going to start with the vaginal suppository. I'm going to make sure I've provided privacy and have a drape just to ensure that my patient is as comfortable as possible. So I'm going to go ahead and fill the applicator with the mechanizole. I'm going to put lubricant on the applicator so it's as comfortable as possible. I'm going to go ahead and make sure the area is clean and dry, and then I'm going to insert this 7.5 to 10 centimeters, and then go ahead and administer the medication. I'm going to make sure that the area is still clean and dry after administering the medication, and then just let the patient know that they could experience, the mechanizole is to treat the yeast infection, so I want to let them know that they could experience even more itching and burning, any discomfort, and just to let us know if anything excess happens with that. So for the rectal suppository, we're going to use the preparation H, which looks like this. And so again, we're going to provide privacy and make sure they're as comfortable as possible. Again, make sure it's the same medication, the right medication, the right person, the right time, and the right route. So again, we're going to have the draping, just again to provide privacy. I'm going to put the lubricant. I'm going to make sure my patient is laying on their left side. I'm going to put the lubricant on the suppository. I'm going to insert the suppository with the rounded edge going in first. Don't insert it with the blunt edge first. And I'm going to go ahead, put lubricant on my finger just so I can insert it properly, again for the most comfort. I'm going to go ahead and insert it up to 5 to 10 centimeters just past the internal sphincter. And then I'm going to make sure that the area is clean and dry again. Provide privacy. I'm going to let them know they might feel some discomfort. Also, before I do any suppositories, I'm going to make sure that they don't have to use the restroom, because they do have to lay there for about 10 minutes until the medication is all the way delivered. And then I'm going to come back. I'm going to assess and make sure I document everything that I did.